The World Health Organization is tracking a new variant of interest as it monitors the evolution of the virus that causes COVID-19. It's called the Mu variant. First detected in Colombia at the start of the year, Mu has been reported in sporadic outbreaks in parts of South America and Europe, but it hasn't taken hold the way the Delta variant has, and experts say it shouldn't be a major worry for Australians. While it accounts for only a small slice of global cases, scientists are studying whether it could have properties that would help it get past immune protections built up by vaccination or past infection. Here's what we know about the Mu strain of SARS-CoV-2. What is the Mu variant? Also known as variant B.1.621, the Mu variant of COVID-19 was first detected in Colombia in January, and it's now been listed as one of 5 variants of interest by the WHO. That means that while the WHO considers it worthy of special monitoring, it's viewed as less of a potential problem than the Delta or Alpha strains of the SARS-CoV-2 virus, which have been designated variants of concern due to their increased virulence. It's the first variant of interest to be added to the list since June, when the Lambda variant was included in the list. According to the WHO's newest epidemiology report, Mu has been listed as of interest because it has a constellation of mutations that indicate potential properties of immune escape that need to be studied further. Paul Griffin, an infectious disease expert from Mater Health Services and the University of Queensland, said health experts were constantly on the lookout for escape variants that might find it easier to infect vaccinated people through mutations on the virus's spike protein. If that spike protein was to change significantly, then there's certainly the potential that our vaccines may work less well, he said. We do think there will be a time where that becomes quite likely, but we haven't actually seen that yet. The WHO stressed that more research was needed to understand the Mu variant's effects, but Dr. Griffin said there was no evidence yet that suggested Mu fit the bill as an escape variant. According to the WHO, Mu's prevalence in global COVID-19 infections has actually declined since it was first detected. However, the prevalence in Colombia, 39%, and Ecuador, 13%, has consistently increased. It accounts for less than 0.1% of all global COVID-19 infections, but outbreaks of B.1.621 have also been reported in parts of the US and Europe. What could the Mu variant mean for vaccines? The WHO's epidemiology report says that preliminary data showed Mu appeared to be more resistant to antibodies, but Dr. Griffin said those lab tests don't give the full picture to how human immunity works in the real world. Those neutralizing studies are really useful, because they're quite easy to do and they're quite quick, but they're part of the story, not the whole story, he said. We need to see that clinically, so in the real world, we do see a change in properties that mean the vaccine actually loses efficacy. Which other variants are monitored by the WHO? It's the 5th variant of interest to be listed by the WHO as a variant of interest, and there are also 4 more serious variants of concern. All 9 of the designated variants are named with a different letter of the Greek alphabet.